My name is Matthew Edwards. I'm an actuary and editor of the actuarial profession's main mortality publication, the Longevity Bulletin. A lot of the press coverage around the pandemic and references to epidemiology, indeed the government's own line of "we're following the science," has blurred the distinction between two very different things, the past and the future. Now, the past and the future may seem obviously distinct, hard to confuse, but here's how it's happened. Epidemiology has, to my mind, been about studying past data, or, to give the epidemiologists all due credit, setting up studies to collect data, to analyse, to derive important information about such things as the harmful effects of smoking, to name one of the oldest examples of great epidemiology. The analyses of infection and mortality data during the pandemic are examples of epidemiology, allowing us to estimate the much talked about infectiousness parameter R and the infection fatality rate. So that's all about the analysis of past data and what you might call science with a capital S. The other thing we've heard a lot about is the modelling of future infections and deaths. So we take a particular model structure, typically something that simulates the spread of the infection and the ensuing deaths and further contagion and so on and so on. And to make that work, we need our estimates of R and the infection fatality rate. So we use those analyses of past data derived from science with a capital S. So we've got work based on the past that we could regard as factual, although there's still much uncertainty in many of those analyses. And we have the modelling work looking into the future, which is highly conjectural, even if we base it as much as we can on historical analyses. But what happens when a government briefing says we're following the science? Do they mean they are talking about analysis of past data or talking about projections of the future? Are they conflating the two concepts? Actuaries try to be clear to our stakeholders about this distinction between work based on past data and the much more uncertain work based on looking into the future. There must be a lesson here in how we can help people better understand the limits of these two fields.